Small cell lung cancer (SCLC) is a type of lung cancer characterized by the rapid growth of small cells. It tends to grow and spread more quickly than non-small cell lung cancer (NSCLC). SCLC is often associated with cigarette smoking, and it accounts for about 10–15% of all lung cancers. Causes. The primary cause of SCLC is smoking. Other risk factors include exposure to secondhand smoke, exposure to certain chemicals and substances, such as asbestos, radon, and uranium, and a family history of lung cancer. Symptoms. Symptoms of SCLC are similar to those of other types of lung cancer and may include 1. Persistent cough. 2. Chest pain. 3. Shortness of breath. 4. Fatigue. 5. Unexplained weight loss. 6. Coughing up blood. Diagnosis. Diagnosing SCLC typically involves a combination of imaging tests, CT scans, PET scans, biopsies, and sometimes molecular testing to identify specific genetic characteristics of the cancer. Staging. SCLC is often divided into two stages: limited stage and extensive stage. Limited stage means the cancer is confined to one lung and nearby lymph nodes, and it can potentially be treated with localized therapies. Extensive stage indicates that the cancer has spread beyond the lung to other areas of the body. Treatment. Chemotherapy. This is a primary treatment for SCLC. Due to its aggressive nature and tendency to spread quickly, chemotherapy is often used even in cases where the cancer is limited to one area. Radiation therapy. This may be used in combination with chemotherapy, especially in cases of limited-stage SCLC. It can help shrink tumors and prevent the spread of cancer to the brain. Immunotherapy. While less common than in non-small cell lung cancer, immunotherapy may be used in some cases, especially for extensive-stage SCLC. Surgery. Surgical removal of the tumor is generally not a common approach for SCLC due to its tendency to spread early. However, in very limited cases where the cancer is confined to a small area, surgery may be considered. Life expectancy. Survival rates for small cell lung cancer (SCLC) are generally lower compared to non-small cell lung cancer (NSCLC), because SCLC is often more aggressive and has a higher tendency to spread rapidly. Like with NSCLC, survival rates for SCLC are reported in terms of the percentage of people who are alive a certain number of years after diagnosis. It's important to note that survival rates are statistical estimates and may not predict an individual's outcome. Many factors can influence survival, including the stage at diagnosis, the overall health of the patient, and how well the cancer responds to treatment. Here are general survival rates for small cell lung cancer based on the stage at diagnosis. Limited stage SCLC. The 5-year survival rate for limited stage SCLC is typically in the range of 20% to 25%. Limited stage SCLC means that the cancer is confined to one lung and may involve nearby lymph nodes but can be encompassed within a single radiation therapy field. Extensive stage SCLC. The 5-year survival rate for extensive stage SCLC is generally much lower, often ranging from 5% to 10%. Extensive stage SCLC means that the cancer has spread beyond one lung to distant organs or structures and is not encompassable within a single radiation therapy field. SCLC is often diagnosed at an advanced stage when it has already spread, which can impact survival rates. It's crucial to approach these statistics with caution, as they provide general estimates based on population data and might not accurately predict the outcome for any individual case. Advances in treatment, including chemotherapy, radiation therapy, and, in some cases, immunotherapy, have improved outcomes for some individuals with SCLC. However, the overall prognosis for SCLC remains challenging, highlighting the importance of early detection and ongoing research into more effective treatments. Regular discussions with healthcare providers can provide individuals and their families with personalized information about their specific situation and treatment options.
The information provided here is for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or heard in this content. If you think you may have a medical emergency, call your doctor or emergency services immediately.